soon as the government steps in and says you have to buy a service or good, that's a trampling on our liberties. That's a trampling on our freedoms. It, in my opinion, is unconstitutional. I don't believe that the government would be able to run healthcare any better. In fact, I think they would do much worse than how things are right now. The whole issue that came up in this past year with it is really not about healthcare. We do have the best healthcare system in the entire world. People from all over the world come to America to get their healthcare. It's not about healthcare reform. It's all about healthcare payment reform, and people getting their share of the money, and that's really what it's all about. The question would then come up, well, since we need to know who's getting the share, where is the payment coming from? And the government has decided that we're going to hit the taxpayer for that. So the other thing that people don't really understand is that it kept being portrayed as, oh, well, what about these people who are 30 years old and they get Hodgkin's lymphoma and they don't have insurance? Well, I'm going to be honest with you. I've never seen someone who didn't have insurance who got Hodgkin's lymphoma that didn't get taken care of. They do get taken care of. They do. So many hospitals in this country are nonprofit. By law, they have to give a certain percentage of free health care. By law, they have to do that. And nobody stops and says, I'm not going to take care of this person because they don't have insurance. That person has always gotten taken care of. That's one of the great things about our country, is that we do care for each other and help out. That is the decisions that the doctors, the nurses, the hospital administrators all make, that we're going to help this person out. There's a big difference between those people making this decision that I want to help and the government saying, you have to do this, and we're going to take money from others to make sure you're paid for it. That's where you start stepping over the bounds of what is legal, what is right, ethically and morally, and the government saying, we can make your decisions for you better than you can make them for yourselves. It's a huge subject as far as what the government and what they're doing there. But when it really comes down to it, it has nothing to do with healthcare reform. It has everything to do with people getting money, whether that's the government, whether that's insurance companies, whether that's doctors or hospitals. Is all to be looked at, but it has nothing to do with the care for patients.